Some of the most commonly held understandings about depression may not be true. New research out of the UK claims there's no convincing evidence depression is caused by low levels of serotonin. And just to mention, anyone who has questions about SSRIs should speak with their doctor about what's right for them. Well, one of the authors of the review is Dr. Mark Horowitz from the University College in London, and he joins me now. Thank you so much for your time on this, Dr. Mark. I appreciate you coming on. Just tell us about your study, what was involved, and how did you get to this conclusion?
Hi, Lara. Thanks for having me on. So this idea that depression is caused by low serotonin has been very widespread. It's often communicated to the public as being a chemical imbalance. So people are, if you ask the public, about 90% of the public thinks that depression is caused by a chemical imbalance. And this hypothesis, this idea that serotonin can cause depression, has been around for about 60 years. And we wanted to go and look in the scientific studies, is this hypothesis, is this idea about depression supported? So what we did was a systematic umbrella review, looking at all the studies that have been conducted in this area. We looked at levels of serotonin in people's blood, in the fluid around their brains. We looked at studies that had looked at imaging of receptors in the brain. We looked at the genes that determine serotonin levels. We looked at this in depressed people and in healthy controls. We found 17 large studies with tens of thousands of patients. And overall, when we looked at every area that has been thought to support this hypothesis, we found there was no significant difference between people with depression and people without depression. So there is no evidence that low serotonin or low serotonin activity is the cause of depression. And we conclude that
But so if you're looking at all of these categories, which demographics were you looking at? Did it differ in people's ages, gender? Was it people with major depression order? Was it depression as a comorbidity?
Right, so we restricted our study to look at adults. We didn't look at children. We looked at major depressive disorder. We didn't look at things like bipolar disorder, which can cause depression. So looking just at adults with major depressive disorder and similar disorders, that's what our study focused on.
When you refer to a chemical imbalance, are you referring to an individual's brain and how it was formed at birth, or situations that could have impacted the way that the brain operated? So perhaps, you know, if someone with complex trauma could have reduced serotonin development.
Right. So it's a good question. What are we actually talking about here? So the original hypothesis, which was put forward in the 1960s, was this idea that low levels of serotonin, a particular chemical in the brain, might be the cause of depression. And that's been communicated to the public with this phrase, a chemical imbalance. The idea being that the chemicals in your brain are somehow out of whack. It's a little bit unclear what that means, to be honest, because it's not clear what a correct chemical balance would be. So it's been seen as something that doctors have used to communicate to patients, tell them there's something wrong with their brain. And as you say, there hasn't been any real detail about is that caused by childhood events or adult experiences. But what we can say is that this idea that low serotonin is the cause of depression is not supported by the academic studies that have been conducted so far.
But if an individual is just prescribed SSRIs, it's not just serotonin which assists in depression. There's other neurotransmitters in that. So there's things with dopamine, there's other products in that which can assist someone's improvement in their brain functionality. It's not just serotonin that is just dispensed in an SSRI.
Right. So then this question comes up, you're asking, how do antidepressants work? And I think the honest answer is we're not quite sure, because the story that we were told about how they work is that they increase serotonin, and that reverses this underlying abnormality of low serotonin. And people have often been told this analogy, it is like taking insulin for diabetes. In diabetics, there's not enough insulin, you give them insulin, and that fixes the problem, and it seems like a neat solution. But when it comes to antidepressants, we can't say that these drugs that increase serotonin are fixing an underlying lack of serotonin, because that's not supported by evidence. And so we're not quite sure what antidepressants are doing to the brain. As you mentioned, they affect a whole lot of different neurotransmitters, and we're not sure what that effect is exactly.
So when you say there's no evidence that supports this, I mean, any quick, I'm not obviously a doctor, but a quick Google search will show that there's been several peer-reviewed articles which have been published. We see in The Lancet, one of the leading medical journals, put something out in 2018 that even states all antidepressants were more efficient than placebo in adults with major depressive disorder. So it's not as if the sense that it doesn't exist, that research published doesn't exist. Are you saying that the existing research, all existing research, is not correct?
So I think there's two things to separate here. One is what is happening in the brain in depression and what do antidepressants do, and then a question of whether they're effective or not. So to deal with the first one, what we're saying is we're talking about the story that people are conveyed, that antidepressants are fixing a chemical imbalance, like insulin fixes diabetes. We can say after our review that is not supported by the evidence. The second question of whether antidepressants are effective, whether or not we know how they work, is a different issue. The Cipriani meta-analysis that you've referred to has been very contentious because it actually shows very small differences from placebo, from sugar pills for antidepressants, a couple of points on a 50-point depression score. There are all sorts of issues with placebo effects when people get medications. They experience hope and expectation that they'll get better, and that might help them. So there is huge debate over whether antidepressants are effective. But the take-home from our study is the message conveyed to patients about what these drugs are doing. We can't say that they fix some underlying chemical cause of depression. Whether they're effective or not is a slightly different question.
What has been the response from the medical field by your publishing of this research?
It's been an interesting and mixed response. Some psychiatrists have said that they never supported such a theory, that they never said that there was low serotonin or a chemical imbalance. But 90% of the population have been convinced that that is what causes depression, and that message must have come from somewhere. So I think that message has been put out by drug companies and academics.
Sorry, just to pick up on that, are you saying that there's an issue with the messaging as opposed to the actual research?
Well, it depends on people's opinions. So I would say the facts are most of the population have been led to believe that depression is caused by a chemical imbalance. That's what they say in surveys. The science doesn't support that. And so there has been this disconnect between the science and what people believe, whether that comes down to a communication issue or whether people just have not informed the public of these academic findings, I'm not sure. But I think the public should be made aware that there is no evidence that depression is caused by a chemical imbalance for low serotonin.
And that's from your research, that's what you're deducting from that?
Yes, and I should say, we're not the only people to have said this. For the last 20 years, many academics have said this is not supported by the science, the simple idea that depression is caused by a chemical imbalance. We've just done the latest study that was very comprehensive to make this point.
Well, I think there's
lots of other
I think there's a wealth of information which contradict that. The other thing, to your point, when you said about people can be experiencing symptoms that are not positive by taking antidepressants, there is... People are warned when they take antidepressants that if you react negatively to this, there might be another tablet that might be ideal for you. But that's with any medication, though, isn't it? We can get negative side effects to one thing and not to another. That's just how humans work, is it not?
Sure. So I think the point comes down to information. Patients should be given informed consent for these medications. They should be told what the benefits are, that there's small differences from placebo in patients, that there are possible adverse effects, that half of people can experience sexual side effects, there's weight gain and nausea, that the medications can be difficult to stop, that half of people have withdrawal effects, and maybe up to a quarter of people will have severe withdrawal effects, as well as the alternatives. So we know that there are a wide variety of alternatives that are effective for depression, from exercise and mindfulness and problem-solving therapy. So if people are told about these things and they choose to take antidepressants, and that's completely reasonable, but I guess we should just be informing them and also being clear about what they're doing, that they're not curing a chemical imbalance or fixing the underlying chemical problem in depression. And then I think we're being honest and transparent with our patients.
Dr. Mark Horowitz from the University College of London, thank you so much for your insight on your particular research.
Thanks for having me, Lara.
And if you need information or support